There's a dangerous secret that the medical industry desperately hopes you'll never discover. Right now, millions of seniors are lining up for routine health checkups, believing they're doing the responsible thing, believing they're protecting themselves, believing they're catching problems early before they become serious. But what if I told you that some of those tests, the routine ones your doctor insists you absolutely need, could actually be pushing you closer to unnecessary surgery, dangerous complications, or even triggering the very diseases they're supposed to prevent? New research reveals something shocking. Up to 37% of medical tests performed on seniors lead directly to unnecessary treatments, serious complications, or lifelong side effects. 37%. That's more than 1 in 3. And here's what should terrify you. 99% of people over 70 have absolutely no idea they're being systematically over-tested. One of these checkups, the number one on our list today, actually causes 5% of all cancer cases in the United States. That's equal to the number of cancers caused by drinking alcohol every single day. You won't hear this from your doctor's office. You won't see it on hospital billboards, but the truth is buried in scientific literature, and today we're bringing it into the light. In this video, I'm revealing the 5 health checkups you should seriously reconsider after 70, and the terrifying truth about what they can do to your body. Everything is backed by published research and real patient outcomes, and what made it to number 2 will shock you, because it's one of the most commonly recommended procedures for seniors. Before we start, drop a comment below. Where are you watching from? What's your age? Have you ever regretted a medical test or procedure? Do you think seniors are being tested too much? I personally read and reply to every comment with advice for your situation. If this information could save someone's life, hit that like button and subscribe so you never miss videos that could protect you from unnecessary harm. Now let's talk about the first test. It sounds harmless, but it could quietly destroy your quality of life. Number 5. Bone density scan, DEXA scan. It sounds perfectly responsible. A quick, painless scan. No needles, no discomfort. You walk out knowing whether your bones are at risk for fractures. But here's the truth nobody tells you. After age 70, a bone density scan often creates far more fear than actual benefit. This test, called a DEXA scan, measures bone strength. It's designed to detect osteoporosis, but in older adults, especially women, the results almost always show lower bone density, even when there's no real danger. Why? Because bone loss is completely natural, like wrinkles or gray hair. It happens to everyone. Your bones at 75 aren't supposed to look like they did at 45. Yet millions of seniors get immediately pushed onto medications called bisphosphonates, drugs like alendronate that are supposed to strengthen bones but come with devastating side effects. We're talking about jaw osteonecrosis, where your jawbone literally starts dying, severe esophageal irritation that makes swallowing painful, and atypical fractures, where bones break in strange ways because the medication makes them brittle. Here's what should make you furious. Studies show these medications have almost zero impact on actual fracture rates in people over 70. A study in the Journal of the American Geriatric Society followed over 1,200 women over 70 for 5 years. The bisphosphonates reduced fracture risk by only 0.3%. 0.3, not 30%. 0.3. Meanwhile, those same women were far more likely to suffer medication side effects, digestive problems, and paradoxically, bones that became more fragile. Let me tell you about Rose, a 76-year-old retired piano teacher referred for a DEXA scan during her annual checkup. She'd never fallen, had no bone pain, walked daily. Her scan showed osteopenia, mild bone reduction that's not even full osteoporosis. Her doctor immediately started her on alendronate. 3 months later, Rose had severe reflux and jaw pain. She hadn't played piano in weeks. We stopped the medication immediately, started her on vitamin D, weight-bearing exercises with resistance bands, and a calcium-rich diet with sardines and leafy greens. 1 year later, Rose was performing piano recitals. Stronger legs, better balance, zero fractures. A 2022 study in Osteoporosis International proved this approach. Strength training, balance exercises, proper nutrition, and vitamin D reduced fractures by over 20%, better than medications without the side effects. Don't let a scary number push you into treatment you don't need. But there's one test that can lead to something even more dangerous: brain surgery. Number 4. Brain MRI for memory loss. When seniors feel forgetful, the natural response is fear. Fear of dementia, fear of Alzheimer's. So doctors order a brain MRI. But here's the uncomfortable truth. MRIs in people over 70 rarely provide helpful answers. Most MRIs simply show age-related changes, slight shrinkage or white matter spots that are completely normal in older adults. But once those spots appear on the scan, they trigger a devastating cascade. More tests, more anxiety, even invasive procedures that don't improve memory and can make things worse. In 2021, a study in Neurology Today reviewed over 3,000 MRI scans in patients aged 70 to 85 with mild cognitive complaints, just typical forgetfulness. 86% showed some brain abnormality, but only 3% were linked to a treatable condition. That means 97% of people experienced the trauma of hearing something's wrong with your brain when there wasn't anything abnormal for their age. Worse, nearly 12% were sent for invasive procedures like spinal taps or biopsies, all based on vague findings that meant nothing. Let me tell you about George, a 74-year-old retired engineer worried about his memory. He was sharp but misplaced keys sometimes and forgot names at gatherings. His doctor ordered an MRI showing white matter changes. George panicked. He stopped driving, stopped going to church, withdrew completely. His anxiety spiraled, which made his memory worse because anxiety destroys cognitive function. When I tested George with standard cognitive screening, his scores were perfectly normal for his age. Those MRI findings were expected and harmless. We focused on lifestyle, better sleep, proper hydration, anxiety reduction, brain games, social activities. 3 months later, George's memory stabilized and he felt like himself again. No medications, no procedures. Unless you have severe symptoms like seizures, sudden personality changes, or rapid decline, an MRI is rarely helpful for mild forgetfulness. A better approach is a simple cognitive screening test. Paper-based, inexpensive, effective, and it avoids unnecessary panic. Now brace yourself because the next test is one you've probably had multiple times. Number 3. Cardiac stress test. This is one of the most commonly ordered tests for seniors with mild fatigue, occasional chest tightness, or just not feeling like they used to. The cardiac stress test monitors your heart on a treadmill or with medication that simulates exercise. It's designed to spot blocked arteries. But after 70, this test often does more harm than good, especially when used on people without clear heart disease symptoms. The problem is accuracy. Studies show that in adults over 70, the false positive rate can be as high as 40%. 40%! That means 4 out of 10 people are told they have heart problems they don't actually have. Those false alarms lead directly to follow-up tasks like angiograms and frequently result in unnecessary stent placements or bypass surgery. A 2017 study in JAMA Cardiology found that over half of all stents placed after stress tests were done in patients with no symptoms and no benefit whatsoever. Zero improvement in survival. Zero improvement in quality of life. What they did get were higher rates of bleeding, kidney injury from contrast dyes, and prolonged hospital stays. This happened to Raymond, a 75-year-old retired postal worker who walked daily. During a checkup, he mentioned feeling tired on hills. His doctor scheduled a stress test. Results were unclear, so he got a cardiac catheterization. Mild narrowing was found and a stent placed. That night, Raymond reacted to the contrast dye and developed kidney problems. 6 days in the hospital, weeks of follow-up care. The fatigue never improved because it wasn't a heart problem. He needed better hydration and rest between activities.
If you're over 70 without classic cardiac symptoms like chest pain during activity, significant shortness of breath, or dramatic energy drops, a stress test may cause more harm than good. Better options include a resting EKG or coronary calcium scan. Safer, simpler, less likely to push you into unnecessary procedures. Now we're at number 2, and you probably didn't see this coming. Number 2, colonoscopy after age 75. You're shocked to see this here, but colonoscopy is not always wise after 70 and almost never recommended after 75 unless you have specific symptoms. The risks increase dramatically with age. The preparation is harsh, involving powerful laxatives causing dehydration, dizziness, electrolyte imbalances, and kidney problems. The sedation poses risks to brain function and cardiovascular stability. The procedure itself can cause bleeding, bowel perforation, and heart rhythm disturbances. A 2019 study in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older. The shocking results? For every 1,000 colonoscopies in patients over 75, only 2 lives were saved, but over 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio, 10 times more harm than good. Even when polyps are found, many are small and slow-growing. Removing them in older adults can cause more damage than leaving them alone. Dana was a 73-year-old grandmother running a bakery with her daughter. No symptoms, no bleeding, no bowel changes, no weight loss, no family history of colon cancer. Her new doctor, fresh from residency, strongly urged screening colonoscopy. Dana agreed, a small polyp was removed. She went home. That night, intense abdominal pain. She fainted. At the ER, doctors found a bowel perforation. 9 days in the hospital, lost 10 pounds. Energy never fully returned. When we reviewed her case, she'd had 2 clean colonoscopies in the past decade. No medical reason to repeat it. The U.S. Preventative Services Task Force recommends stopping routine screening at 75. For those in excellent health, a resting EKG or coronary calcium scan is safer, simpler, less likely to push you into unnecessary procedures. Now we've reached the most overused, most dangerous test for seniors. Number 1, annual full-body CT scans. Full-body CT scans are marketed as premium preventative care, offered in executive health packages at private clinics. They promise to catch cancer early, find problems before symptoms appear. But here's the shocking truth. These scans expose your body to massive radiation doses. For older adults, the risk of triggering unnecessary follow-ups, painful biopsies, and major surgeries is extraordinarily high. The ultimate irony? Zero evidence that full-body CT scans without symptoms save lives. Each scan delivers 10 to 20 millisieverts. That's equivalent to 500 chest x-rays at once. A 2023 study in JAMA Internal Medicine revealed that rising CT scan usage may now cause up to 5% of all U.S. cancers. 5%. That puts CT scans on par with daily alcohol consumption as a cancer-causing factor. 1 in 5 cancers could be caused by a scan designed to prevent disease. That's not just counterproductive, that's terrifying. These scans detect harmless nodules, benign calcifications, simple cysts that are normal aging. But once seen, red flags go up everywhere. More scans, biopsies, anxiety, complications from the biopsies themselves. Marcus was an active 80-year-old teaching martial arts to younger seniors. He felt fantastic and got a senior elite checkup at an upscale clinic. His full-body CT showed a tiny 3-millimeter lung nodule, smaller than a pencil eraser. Chain reaction. Referred to oncology. PET scan. Needle biopsy. Result? Completely benign. But the biopsy collapsed part of his lung. Hospitalized. 2 months recovering. All for something that should have been left alone. Experts clearly state full-body CT scans should never be used for general screening without symptoms. The American College of Radiology is unambiguous. No proven benefit, significant potential for harm. If you have symptoms like unexplained weight loss, coughing blood, or visible masses, targeted imaging makes sense. But scanning your entire body with no specific concern is like searching for treasure in a minefield. You might find something, but the damage could be far worse. 5 checkups that seem helpful but can cause serious harm after 70. Modern medicine is powerful but imperfect. Sometimes less is more. Before any test, ask your doctor what happens next if this finds something. If the answer is unclear or if risks outweigh benefits, reconsider. Real prevention comes from lifestyle. Stay active, eat nutritious foods, get deep sleep, manage stress, choose checkups wisely. Have you or someone you love faced complications from an unnecessary test? Share your experience below. Your story could help another senior avoid the same mistake. If you found this valuable, hit like and subscribe for more truth your doctor might not tell you. Thanks for watching. Remember, you have the right to question and say no to tests that don't make sense.